Okay, so here's our direct side-by-side comparison of the differences between what we call functional endocrinology and your more traditional medical approaches. So the most important question, no matter what problem I'm trying to solve, or however I'm trying to help some person, is why. So why is the struggle there? Why is the problem there? And I think, as logical and obvious as this question is, that is not the questioning process of your traditional medicine. They are condition managers and things like that, so they're not looking at that underlying why. And again, we're going to see some subtle yet really important and distinct and unique differences. So why is the most important question. Why is there a struggle here? So if we look at one basis, that's functional versus pathological viewpoint, and this is kind of a big picture concept in terms of how we approach differently, but the difference is treating an action or a process versus treating a structural change. And this is what medicine does, is they're looking for that pathology. There's a cancer, there's a bone spur, there's a plaquing, which means that fatty gunk in your arteries. There's an infection, I misspelled that. And we're treating a process, like a digestive process, like a circulation process, like the process that you go through to use vitamin B12 to get oxygen to your kidneys. There's a process, steps of action that are required. Medicine also looks at the shifts in chemistry that cause a structural change, and that's where diabetes really doesn't have a pathology. There's not something you can look at under a microscope necessarily, but these are associated. You keep up these numbers long enough, and you will have that. If you keep up these numbers long enough, you will have clogging of your arteries or heart disease. So the big question is the why versus the what. So when you're going to your doctor, they're looking at the what, and we're looking at the why. So again, subtle but very important. So here's the fertility requirements, and this is going to eMedicine, the Mayo Clinic online. I use the physician login at eMedicine to get into more technical information, but this is what they say is required. You have to release a normal egg, number one. Okay, and I would agree. But how do you release a normal egg? What has to happen in order for you to release a normal egg? If you go back to my "How is this supposed to work" video, we'll answer some of those things. But you have to have, just to review, or to go over if you haven't seen that yet, you have to have low steroid hormones at the beginning of your cycle, or you don't get follicle stimulating hormone release. You have to have a surge in follicle stimulating hormone, which causes a surge in estrogen, which causes a surge in luteinizing hormone, and then, only then, do you get a egg. So what has to happen? They're just looking at the what. You have to have that. We're looking at the why. How does that happen? You have to have adequate sperm counts and viability and things like that. And again, we both might count those, in terms of the differences. But we would look at why there is a functional decrease, or why they aren't working properly. And that gets into the whole pituitary, thyroid, gonad, and even the pancreas, the endocrine and the insulin process in the man. Then the transport of the eggs to the fallopian tubes, and transport of the embryo to the endometrial cavity. So it's very structural, so the egg has to be there, it has to go somewhere, and then it has to be fertilized, and then it has to go somewhere again. And there's a lot more hormonal movement that has to occur than just those structural things. And they're just not looking at them. They're not looking at the whole female cycle and looking at all the male hormones and things like that. So they're not getting the underlying why. So this is the listed causes of fertility, and I think this is rather humorous. I'm sure if you were labeled this, you don't think it's funny at all, but the normal infertile couples, which is just like throwing up their arms and saying, I have no idea. And they say that about 10% of people are affected, or 10% of infertile couples are normal infertile couples. And I guess that would mean, like, if you go backwards, that there's an egg, there's sperm, and there appears to be transportation, but it doesn't seem to ever happen. So why would that be? They say that there's a very poor prognosis with these folks, and they don't know where it's coming from, but is it something here with the sperm and embryo? Is it the quality of the embryo, the disruption of the implantation site? Is it because they miscarry? Is it because there's never a fertilization? Why? You know, they don't ask that question, so they just say it's a normal infertile couple. And these are all very purely functional problems, which means that it's a problem with the process and a problem with the action steps, which is the process. So again, now I'm not saying that this whole medical approach is ineffective. I'm just saying, like, here's a different way of looking at things and a deeper. And so we actually have solutions for normal infertile couples because we can look at those functional processes. If you have scar tissues on your fallopian tubes, then working on the functional process is not going to, that is a medical problem. So we want to distinguish which is a medical problem and which is a functional endocrinology problem, and get you in the right place. Because for functional endocrinology problems, you'll only be forced into pregnancy via their more dramatic and highly expensive and not super effective methods. So causes of infertility from the female perspective is the cervical factor. They say, well, okay, the 5 to 10% are because there's the cervix does not allow entry, and they say that's because of a change in the mucus around the cervix, and it doesn't allow the sperm to enter. They say this is caused by low estrogen, and however, treating with estrogen does not have favorable results, so the treatment of choice with this problem for the 5 to 10% is intrauterine insemination, so they just stick it in there. Now, because I would say there's a reason why the estrogen is low, and we have to look at that and functionally, see what kicks into your body having low estrogen. And I'll tell you just briefly, we'll get into the diagnostics in another video or another presentation, but primarily inflammation, toxicity, and autoimmune problems, or any immune dysregulation, any immune problems will cause the ovaries to not release the steroid hormones. So again, this is, you can see some structural changes like in the mucus, but it's very much a functional problem. Female factors, uterine, we're looking primarily at endometriosis and uterine fibroids here, and this is a smaller percentage, 2 to 5%, and they don't know exactly what caused this, but now this is more related to high estrogen. So why does the body have high estrogen? So this is a structural problem. This is a medical problem, and many times, the most conservative surgery possible is probably appropriate. And how do they diagnose these things? They look at it, of course, and the treatment. I would look at the most conservative surgery if it is literally physically blocking this process. But they do these basically pituitary stimulants so that it shuts down your cycle. And of course, that's not very good for fertility, but it's good for the endometriosis. So if there's no physical blockage and you're trying to figure out why you have fibroids or why you have endometriosis, then we start to look at the estrogen levels being high and what causes that, and is it related to insulin, is it related to cortisol and other hormones, because it is that interaction in the endocrine system that basically produces these shifts that cause dysfunction and pathology like endometriosis and fibroids. And of course, they'll even give testosterone for the fibroids to stop that. And there's just more functional ways to look at that by addressing the underlying cause, the estrogen. We look at the ovarian factors. Now this is the vast majority of the infertility problems, is the lack of ovulation. And the primary causes are lack of a normal cycle, so lack of menstruation, or an abnormal cycle, dysmenorrhea. And this is caused by dysfunction of the endocrine system and polycystic ovaries. So this is really your number one cause, the polycystic ovaries. And the treatment there is the Clomid and metformin, and I'm sure you know the significance of that. It's very aggressive, and we can treat these things naturally. In fact, on my website I have a testimonial of a patient who, on follow-up, and we weren't treating her for fertility, but just general health, and this polycystic ovaries was one of her complaints, and she went in for her annual checkup, and they're like, where's your cysts? We can't find any. And we primarily treated her immune system, her pancreas, and her adrenals. So that resolved the issue. There was no surgical process. Dysfunction of the endocrine system, the way they look at the endocrine system is basically this. They look at your TSH, which is a pituitary tumor, or a pituitary hormone, and if it's high, they give you levothyroxine, Synthroid. And then they rule out pituitary or adrenal tumors, like if you have super high cortisol or super high pituitary hormones, and then you'd be in a surgical situation. But these are like one half of 1%. And most of these dysfunctions of the endocrine system are functional, and they can be corrected. In fact, we can correct the high TSH also. We can look at your whole endocrine system and work on those problems. And I can't tell you the number of people who have come to me and said, wow, I started having my period and it just was normal. Like there was no pain and dysfunction associated with it. It just started to happen naturally and normally and comfortably and easily the way it's intended. So these are really the vast majority and really functional problems. So these problems should be treated with functional endocrinology versus looking at this type of treatment. Male factors, decreased sperm count or function, and this is the cause via the Mayo Clinic. Low testosterone, toxins, anti-sperm antibodies. Are you being checked for that? We check you for that. Celiac disease, which is, we check for gluten antibodies. Medications such as testosterone will shut down your testosterone production. Toxins again, heavy metals, stress, and vitamin deficiency. And then the treatment is more testosterone or in vitro fertilization. So pretty big, and then they actually list adoption if you have this. So why can't you treat vitamin deficiency? Why can't you treat the hormonal effects of stress? We all have stress, right? But when it starts to cause a disruption in your adrenal glands and your hormones, then it's a clinical problem, and we can treat that clinical problem. We can't take stress out of your life, but we can treat you so that your hormones are at least imbalanced with that. We can detoxify heavy metals. We can cleanse toxins. We can get you testosterone in a better way than providing it through a medication. And we can test you and get you off gluten. We can, in fact, functional endocrinology is really the only way to treat anti-sperm antibodies, because we have protocols for autoimmune conditions and immune dysregulations. And we already mentioned the toxins. So again, here's your options. We can treat all these things functionally, and again, we'll go over that in another presentation video where how we do the diagnostics and then how we do the treating. So, big picture, functional endocrinology starts toward health. So we keep health in mind, and that's the direction that we're always moving. Is like we're taking measurements and we're saying, okay, this is not healthy and this is not healthy. But instead of trying to manage and manipulate it, we're like, how do we move towards health? So if your cholesterol is high, we don't just block it. We look at the processes that produce cholesterol, because somehow it's producing too much. We look at the liver, we look at insulin, we look at the thyroid. We consider all the system interactions. I mean, that's the holistic model. I call it whole system model. Everything affects everything, and anything can cause anything. So you have to really, check on things like the immune system for sure. All the hormones really communicate between each other, and rise in one hormone causes a change in all other hormones. A drop in one hormone causes a change in all other hormones. So we have to look at that full system. We have to listen and respond to your body's needs, and that's again a very subtle but different philosophy, where we don't see your problems as problems completely. We see them as messages, and we're trying to answer that message. So if the body is saying, I'm not really wanting to drop an egg here, we, instead of saying, yes you will, think of parenting, how that works with kids, and how did it work with you, with your parents. If you say, yes you will, there's resistance there. And if we say, why, and we start to validate and look into, what are the internal stressors that are causing your body to say, I don't really want to drop an egg. I don't really want to move into this process. I think it's a much gentler and healthier way. And we offer that hope and have faith in your body that if we regulate that cycle, I have complete faith. I have so much faith that I offer a full guarantee that we can make this happen for you. We can get your system self-regulating. I have complete faith in that, and I want to teach you to also have that faith. So for more information, these are the videos that we're doing, the 7 critical components, and that is on another page on the website. We'll also have diagnosing the why. That's all the lab testing and inquiring that we do into your body, and then nature's amazing gentle healing, which we talk about the plants and the nutrients that soothe, stimulate, and regulate your body in a healing way. And I can't say enough how the more I learn about plants and botanicals and nutrition, it just amazes me what can be done. Where medicine has nothing for an immune problem, nature provides these perfect plants that move no matter what the situation. If you're shifted this way or that way, it has something that will shift you back. And I see this, and I prove this via lab testing, that these plants are doing what I'm telling you they are. So thank you for listening, and I hope each bit of information that you take in and helps give you some hope and really soothe some of the fears that this can be done, and it can be done naturally, and there's no reason why we have to have the manipulative process going on. So thanks again. This is Dr. Stone.